You know, we live in very interesting times. Despite all the technologies and medical advancements, we're still faced with both acute and chronic disease patterns, and these are rampant throughout our society. And at the same time, we're at a junction, we're at a paradigm shift, and it's imminent. And you're here today, and you're going to hear about this innovative therapeutic device called BEMER. And it's revolutionizing the way that we take care of our bodies, both in sickness and in health. I do have to cover this. This is a disclaimer here. BEMER products are in no way a substitute for professional medical care. There are no medical claims being made from these products. Statements made, they haven't been evaluated by the FDA or government agencies, and they're not intended to diagnose, treat, and or cure any medical conditions or diseases. You should always consult with your physician or primary health care provider if you have any medical concerns. The technology of pulsed electromagnetic field has also evolved as it relates to science and medicine over the past 50, 60 years. In fact, one of the first approvals in the United States for using pulsed electromagnetic fields was back in 1979 for non-union fractures. And we've come a long way since then. It's not just any pulsed electromagnetic field therapy device that works to elicit desired physiological effects, such as those sought out by the NASA scientists. There's some very important parameters that involve wave shape or the waveform that's used, the intensity or flux density of the field, and the frequency. BEMER's patented waveform is the most researched and scientifically studied PEMF application available today. And again, all PEMF devices are not created equal. First and foremost, because the type of the waveform that is used truly matters. And it's the spectrum of frequencies and timely variations of the electromagnetic field that interact with our cells to give rise to these desired physiological effects. This is the technology that's the basis of the BEMER signal, which was created in 1998, and it's really been evolving ever since with research and development, with the newest signal configuration introduced into the international market in 2010-2011. As you can see here, this is the mathematical formulation that gives rise to the BEMER signal. There are multiple devices out there, and again, I want to be very clear, these are not all created equal. When I asked to compare BEMER with other devices, there really is no comparison. The unique complex sinusoidal waves used by the BEMER and the manner in which it's delivered is protected by 5 international patents. And there's no device on the market that has a similar effect. Here's a study that was published looking at the changes in partial pressure of oxygen. There are various 6 different PEMF devices and their effect and change on change of PO2. And BEMER here is represented by product A, and you can see that BEMER performed above and beyond all other devices tested. I want to talk to you about how this works as far as supporting hemodynamics from the perspective of mechanism of action. Well, with BEMER, the pulsed electromagnetic field is delivering a waveform to the body which actually interfaces with tissues, and in particularly microcirculatory tissues, as you see here, arterioles and venules. It uses 2 different frequencies, 10 and 30 hertz. The 10 hertz has a direct effect on the nerval control of the blood vessel, and the 30 hertz triggers production of nitric oxide. And as we all know, NO is a potent vasodilator. But the causes of many, if not all, chronic disease really can be laid out here. How we move, how we groove through the world, lack of regular exercise, how we breathe, psychological, environmental stress, poor eating habits. SAD is standard American diet. And what's the common factor here? Ultimately, poor circulation and oxygen availability, which leads to disrupted bioenergetics. When we look at bioenergetics, it's the study of energy flow through living systems. That means how we take in energy, transform it into a usable form for our body to use, and when we have poor blood flow, low oxygen levels, hypoxia, we have low energy. And this ultimately is a recipe for disease. I want to talk to you about a study that was done. It was called the BEMER user study, and there were 157 subjects that were used in this study, and looking at overall functionality from quality of life to musculoskeletal symptoms, cardiovascular, nerve pain, vascular disease. And you can see here the various inclusions, exclusions. Over 70% total improvement in 6 weeks of use. And this is the really interesting thing that you'll find with your patients. So many doctors ask me, so what's the protocol? What do I use for this? What do I use for that? And it's really quite simple. You use the same application for each individual. What you have control of as the individual user and or the clinician using this is, as far as dosage or dosimetry, is the intensity or flux density. So that means the power and the time exposed to that flux. In general, applications are 8 minutes long on the full body applicator, and effects take place in 2 to 6 minutes and can remain 6, 8, 10, 12, 14, 16 hours depending on the metabolic health of that individual. This is looking at the success rate of BEMER treatment, and this was subject to the duration of continuous treatment, meaning this was twice a day, ongoing for a 8-week period. And you can see here, free of complaint from start in the orange. We'll move here. Increased over, I'm sorry, this was a 6-week period. And improvements also. Now here's an interesting aspect. When you look at after the 4-week period, the improvements kind of decreased, and this is pretty much precisely what I see in practice. Is after 4 to 6 weeks, the improvements, people really tend to get the improvement and maintain that, and then they start noticing, well, I use this for my shoulder, but my hands are starting to improve, or I was very fatigued and I used it for supporting with overall wellness and health, and now my knee starts to feel better. And it's very common to see this in practice. I've worked with hundreds of users and have spoke with thousands over the past 8 years of consulting with BEMER, and I find very few people who don't have any effect with the use and application of BEMER. BEMER has a high level of acceptance worldwide. Physicians, therapists, universities, clinics, rehab centers. A lot of clinicians throughout the United States are just now finding out about BEMER. This isn't something that's generally taught in medical schools. But as we progress in medicine beyond just the pill for every ill or the supplement here, we really need to bring in other modalities beyond our manual manipulative skills and other modalities. Lifestyle, food, not just food we eat, but how we think, how we feel, how we process our environment has a direct effect with how we maintain structure and sustain function.
Hi there, I'm Dr. Laura Berry, and I have been using the BEMER for over 9 years, and I've been a holistic chiropractor for over 26, and in all these 26 years I have not found anything that is efficacious as the BEMER in helping us age gracefully and with a higher quality of life. In my own personal life, it's helped to reduce the inflammation that the body tends to create as it gets older, despite good habits. And speaking of good habits, I've always loved to exercise. And I've been plagued by a lactic acid condition that's well known among athletes as delayed onset muscle soreness. And as a result of using the BEMER, I no longer have this lactic acid condition, which is amazing for us. The BEMER helps your body regulate that production, and you can live a life like you want. The BEMER gives the body the information to heal. This information technology is worth the investment in your health for the rest of your life.
Hi, my name is Mark Girardelli. I was a sports athlete in alpine skiing, and I had a very serious injury many years ago, which became a serious problem for me the last years when I needed to use more and more painkillers to reduce the pain in my knee. But the solution for me was 2 years ago definitely using the BEMER system, which avoids now that I have to take painkillers for any sports I do. And I really have to thank the company that they supported me in a way that they could buy a BEMER to improve my life situation in a way I couldn't imagine before. Thanks for that.
And if I understand, you're a famous world ski champion?
I was a world-class skier. I won 5 times the World Cup Bowl, the overall title in skiing. For example, Lindsey won 4 times the World Cup overall title. Tamara McKinney won it once, and Phil Mayer won it 3 times. So I'm a little ahead of them.
Well, congratulations, and I'm so happy that you're a BEMER user.
Thanks a lot. Thanks a lot.
Thank you.
Hello, my name is Dr. Mary Van Hoy, and I practice in Indianapolis, Indiana. And I'm known as a neurodevelopmental optometrist, which means I address health challenges from infancy all the way to grandparents. And I'm thrilled to have learned about BEMER through a colleague, Dr. Todd Wiley from Spokane, Washington. And I was interested in knowing what's another tool in my toolbox to help my patients. I work with a lot of acquired brain injuries that have visual problems. Or another patient of mine was having some challenges with macular degeneration, which is a deterioration of vision. In only 2 sessions, he improved 2 lines on the eye chart, which I find at 70-some years old is very encouraging. It's non-invasive, it's very quick, and it's very comfortable. So I'm looking forward to more applications. So I think BEMER has a lot to offer. So hopefully this is just the start of my journey. Thank you.
Dear ladies and gentlemen, my name is Dr. Berka. I am a specialist in radiology, in diagnostic and interventional radiology, and I was first introduced to BEMER 2 years ago. To my personal history, or what BEMER means to me, is I am a chronic pain patient with severe impairments in the lower back. Since I'm using BEMER for over 2 years now, I could reduce my pain medication uptake to that point that what I used to take formerly for 1 week, or in 1 week, I don't need it in 1 year anymore. So I was absolutely convinced by the physical vascular therapy BEMER, and I share it very extensively to my patients, especially pain patients in a chronic state of pain, and I see a lot of marvelous results. So that's why I am here and contributing to the distribution of the physical vascular therapy BEMER, not only in Europe but all over the world.
Hello, my name is John Cotter. I'm a family physician. I have a background in rural emergency medicine. I was exposed to the great clinical power of the BEMER therapy after an auto accident about 18 months ago, when we unfortunately had a collision with a tractor trailer load of tombstones. Among the injuries, I had a transected aorta, and it was considered miraculous that I survived. I also had a pelvic fracture and a very complicated left hip fracture and some intracranial hemorrhage, so I was profoundly injured. I was told also that because there was a nearly 24-hour delay from the time of the reduction of the left femoral head, about the top third had been sheared off during our accident and was moved a number of inches, and there was a delay because of the vascular graft. And so I was told that I likely would have about a 30% chance of needing a new hip, and probably every 10 to 15 years subsequent surgery because of the significant risk of avascular necrosis. So I wanted to find out if there are any augmentative methods that could be used to help facilitate healing. We were fortunate to be exposed to BEMER therapy, and we started BEMER therapy, and also we had the advantage of having hyperbaric oxygen therapy. And now, 18 months later, I have only occasional hip discomfort. I'm told by the surgery team in the university that I will not be needing surgery, and I'm really doing extremely well, and I'm very, very grateful to have had the opportunity to be exposed to this wonderful method that now we have the privilege of sharing with some of the folks in our community. So we're blessed and very grateful. Thank you very much.